Welcome to autoimmunity.in. Autoimmunity.in is a platform for people with autoimmune diseases and their caregivers to connect, to share, and to inspire each other through their journeys. Autoimmunity Expert is a series which we have with experts where we simplify autoimmune diseases. Today we have with us Dr. Suvrat Arya, who is a rheumatologist and a clinical immunologist in Delhi NCR. Hello, Dr. Suvrat.
Hello.
So today we're going to be discussing psoriatic arthritis. For the benefit of everyone, could you help us understand what psoriatic arthritis is?
So psoriatic arthritis is an inflammatory autoimmune disease which affects both skin and the joints. Uh, just to say in brief what autoimmunity is, it is basically a state in which our immune system starts damaging our own tissues and cells.
Right.
So the various manifestations of this autoimmunity is based on which target organ is getting damaged. So in psoriatic arthritis, it is the skin and the joints predominantly which are getting inflamed because of an abnormal immune response.
Okay, so what are the different type of symptoms that a person can get once they get psoriatic arthritis?
Yeah, so like the name suggests, psoriatic arthritis usually develops in those who have a skin disease which is psoriasis, which presents with scaling, itching, and redness.
Right.
So, a person who has psoriasis has a risk of developing an arthritis which is called as psoriatic arthritis. So, basically, person will present with joint pain, swelling, stiffness of various joints of the body.
So is psoriatic arthritis more common in men and or women or both? And in what age groups does this typically show up?
Okay, so psoriasis is little more common in men as compared to women. The age of onset is around in young adulthood from 20 to 40, most of the patients, but it can appear in later in life as well. But for psoriatic arthritis, men and women have equal chances of developing psoriatic arthritis. And if we talk about the prevalence, psoriasis is seen in around 0.4 to 2.5% of the population. Whereas out of these people who have a skin disease of psoriasis, around 25 to 30% of patients will develop psoriatic arthritis. So not everyone with skin disease will develop the arthritis. Only one third to one fourth of them will develop the arthritis.
Right. Is psoriatic arthritis hereditary? Should a family be worried about other members of the family getting psoriatic arthritis? And since you mentioned that women tend to get psoriatic arthritis, uh, how do they pass it on to their children during family planning? And should they be concerned about that?
Okay. See, like most of the autoimmune inflammatory diseases, even psoriasis and psoriatic arthritis have a genetic basis. But that does not mean that you will definitely pass on this disease to your children or future progeny. Psoriasis can occur in multiple members of the family, and so is the tendency to develop psoriatic arthritis. But the chance of developing is low, and this should not make you concerned for having a family, because uh, most of the people who have psoriatic arthritis may not have their children having the same disease.
Autoimmune diseases generally, in our previous sessions also, we have seen that they come in pairs or they come together. What are the different types of psoriatic arthritis? And uh, once a person gets psoriatic arthritis, what is the probability that they will develop other autoimmune conditions also?
Okay. So yeah, this is probably a very important question here. So like what are the types of psoriatic arthritis? Psoriatic arthritis usually clinically is defined as five different types. So one is which is polyarticular, which means there involves bilaterally multiple joints of the body. Then second is oligoarticular, only few joints are affected, not all. Then is the DIP joint involvement, like the distal most digits of your fingers. Only this is affected, not other joints. Then is arthritis mutilans, which means total destruction of the joints. And then is the psoriatic spondylitis, which means the inflammation of the spine, like we see in the ankylosing spondylitis, and other joints are not affected. So these are the five basic types. Now, coming to what other autoimmune conditions can be associated with psoriatic arthritis. So, like most of the other autoimmune conditions, they may have hypothyroidism, but like other diseases, rheumatoid and psoriatic usually are not seen together, very rare. Psoriatic and ankylosing spondylitis also usually don't coexist, as in, if a patient has inflammation of the spine, you don't call it ankylosing spondylitis, you call it psoriatic spondylitis. So the terminology changes there. And one inflammatory disease which is not autoimmune in nature but can occur in psoriatic arthritis is gout. So why gout happens is because in psoriasis there is rapid turnover of the skin. That is why there is scaling and itching of the skin and there is redness. So whenever there is rapid multiplication of the cells, our uric acid concentration in the blood goes up, and uric acid level going up can predispose to development of gout.
Wow. So this illness seems to affect different joints in the body, and probably that's why you see different types of psoriatic arthritis and the various impacts it has in the body. Um, how how does one diagnose for psoriatic arthritis? Are there any specific tests? And what is the role of rheumatoid factor in psoriatic arthritis?
Yeah. So another very important question you have put across. Diagnosis of psoriatic arthritis is purely clinical. If a patient with a setting of psoriasis comes with the joint pain, joint swelling, and stiffness, then we can diagnose the patient as psoriatic arthritis. I've already described five different types. So, a patient presenting with articular or joint symptoms may fall into one of these five categories. And there are certain criterias which we use in our day-to-day practice to classify or diagnose as a patient with psoriatic arthritis. Now, coming to rheumatoid factor, in fact, rheumatoid factor is one of the diagnostic criteria that it should be negative for labeling a patient with psoriatic arthritis. But very few proportion of patients, like around 5 to 10%, may still have rheumatoid factor positivity. Like rheumatoid factor can be positive in other autoimmune diseases also. So I
Right.
would just say that rheumatoid factor has no role to play in diagnosis of psoriatic arthritis. Yet very small proportion can be positive for rheumatoid factor.
Right. So this makes it, I guess, all the more difficult to identify psoriasis and psoriatic arthritis patients in comparison to the other autoimmune diseases that we've discussed that are fairly, easy to identify because of the tests. What are the treatment options that a person who gets diagnosed with psoriatic arthritis have?
Yeah. So, since it is an inflammatory disease, our aim should be to control the inflammation, to minimize the joint damage, and to restore the normal joint function. These are the main basic principles for managing psoriatic arthritis. So, we have different classes of drugs, medicines which are used, which are like non steroidal anti inflammatory drugs, which reduce pain and swelling. Then there are steroids which usually are not used in oral form. Like we don't use steroid tablets for treating psoriatic arthritis. But if a joint has severe inflammation, we may inject that particular joint with steroids directly. And then comes the role of disease modifying anti-rheumatic drugs, which are anti-arthritic drugs. And these are not painkillers and neither steroids. And the last one is the biologicals, which we have already discussed in our previous series, are used in rheumatoid and ankylosing spondylitis. Now, besides these pharmacological therapy, there is very important role for regular exercise, weight loss, control of diabetes, and control of blood pressure. Because studies have shown that psoriasis is more of because of lifestyle diseases. If you have diabetes, obesity, hypertension, then probably you are at a higher risk of developing psoriatic arthritis. So to control the inflammation, it is important to control those parameters as well.
These medicines that you talked about, and we've discussed them earlier in our other sessions, how expensive are they or how affordable are they for a patient in India?
So if we talk of the non-steroidal anti-inflammatory or the injectable steroids or the disease modifying anti-rheumatic drugs, these are very much affordable. They don't cost much. But if a patient who is not responding to these standard therapies and we have to go for the biologicals or higher therapies, then the cost may go up. But again, because as in we are speaking, new development is occurring, biosimilars are coming up, so even that cost is coming down now.
All these treatments and all these kind of diagnoses are done obviously by an expert. Um, can you please throw some light on the role of a rheumatologist in assisting a patient who's suffering from various symptoms to identify psoriatic arthritis?
Yes, so this is again a very important issue that should be brought to light is because there is lack of awareness about this branch, rheumatology, and a lot of people don't know that for their illness they probably need to visit an expert who is trained in managing autoimmune inflammatory conditions.
Right,
So this whole group of psoriasis and psoriatic arthritis comes under inflammatory autoimmune diseases, and these patients should visit a rheumatologist for better care and better outcome.
right. Patients often, once they visit a doctor, they look at other alternatives to manage their illness better. Uh, they try and adapt to new diet techniques. How important is the role of diet in psoriatic arthritis?
Yeah, so again, emphasizing this point that there is no particular diet which has to be followed. Most important thing.
Yeah,
But having said that, we have to have a good balanced diet which is healthy. So that means you should avoid high fats, you should avoid high sugars, and avoid processed foods.
yes,
All these are otherwise also not considered as healthy diet, and they are found to have some pro-inflammatory provocation in the body. And if you include diet which is rich in antioxidants and rich in omega-3 fatty acids, then it will help you. Like if you take fresh fruits and vegetables, if you include omega-3 fatty acid rich diets such as chia seeds, flax seeds, avocado, soya bean, or nuts, so this definitely helps to improve and control the inflammation better. Other than that, I don't think we should follow some particular this diet or that diet to control psoriatic arthritis.
right. Does gluten have a role to play in psoriatic arthritis?
Gluten per se is the one which is culprit for celiac disease.
Yes.
So there are a lot of papers which say that avoiding gluten may help you come out of other inflammatory diseases also, but there is no solid evidence or solid proof to say that gluten free will help in psoriatic arthritis.
Right. This is an important revelation because a lot of people think that once I get an autoimmune disease, or even if I don't have it, if I remove gluten, I'll be fine. Most of my symptoms will go away. Uh, Psoriatic arthritis and the medicines that are available, are there any new developments in that field right now to assist patients with better medicines?
Yeah, so till very recently, the last option or the last level of therapy was biologicals.
Yeah.
So recently, there is a new group of medicines which are called as small molecules. So these are targeted medicines which are taken orally. Now, problem with biologicals were they were expensive and they were injectables. And after these molecules, the small molecules, like the example is tofacitinib, when it has come, it has changed the scenario for rheumatoid arthritis. And recently, it has shown that it is very good for psoriasis and psoriatic arthritis as well. So, as per the latest guidelines of management of psoriatic arthritis, they have been included. And as we go ahead, maybe the outlook or the outcome of this disease is going to change forever.
Wow. So there is great hope for psoriatic arthritis patients in this type of medicines that are going to be available. When we did a session of psoriasis, uh, we understood that there is a social stigma that people living with that condition often go through, and most often it's quite damaging to the mental health of a person. Uh, what do psoriatic arthritis patients? What kind of mental health issues do they need to go through? Since then we are part of a community that provides a platform so that people can engage with each other. this becomes a very important element for us to understand. Could you throw some light there, please?
Yeah. See, those diseases which change your appearance, they are hard to hide.
Yes.
So, a patient who is suffering from psoriasis will have skin disease, and because of social stigma, lack of education in the society, people will start considering that he may be contagious, he may transmit this disease to me, and so on and so forth. So, such kind of people will start avoiding themselves going socially. They may leave their job, or they may hide themselves from their family as well. They may not come out openly about the mental or social issues they are facing.
Right.
So we have to understand and we have to make the awareness that autoimmune inflammatory diseases are not infectious, they are not contagious, and they are not transmitted from one person to other just by physical contact. So for rheumatoid, it may be easier to hide the disease if they want to, but for psoriasis, when skin is affected, it is difficult. So these patients may be at more mental stigma or more pressure because of the response from the society. Coming to what how psoriatic arthritis patients can do, what they can achieve, I have a lot of patients of psoriatic arthritis which with proper DMARDs, which proper therapy, not expensive, totally affordable, have completely conquered their disease, have gone back to their jobs and are living their life normally. So this is very true that we cannot attain a medicine free cure for chronic autoimmune diseases,
Right.
but it is absolutely true to control these diseases with proper medication under proper expert guidance. So I would like to use this platform to say that these autoimmune conditions, chronic diseases are very much treatable, and you should just seek the proper care for these diseases.
Wow. Thank you very much. At autoimmunity.in, we aim to create a platform, as I said earlier, for people to be able to engage with each other. To wind up our session today, I'd like to sincerely thank you for your time and your interest and being part of our journey. I hope that again we can collaborate in the future. Don't forget to like and subscribe to our channel. For more information, go over and visit our website, which is autoimmunity.in. And there is a Facebook community where you can meet people just like yourself. You can find it through at Autoimmunity Connects. You can share your updates there and inspire each other with your journey. Thank you so much, Dr. Suvrat.
Thank you.